Hello, this is our week number 1 screencast, and it's titled Systematic Review or Scoping Review. So again, welcome back. I hope you're doing well. I hope you're excited about developing your paper and hopefully creating something that is meaningful to you and potentially meaningful to others. So if you haven't listened already to the screencast illustrating or highlighting the course syllabus, go ahead and do that. Do that after you listen to this lecture, or pause this one and go listen to that one. It's only about 3.5 minutes long and just gives you an overview of what's occurring in the course. So some things to highlight here. So we're in week 1, and in week 1, we got the screencast that you're listening to right now, but coming up in week number 2 and in week number 3, there are no screencasts. What there is a forum in week number 2 for you to fill out. And what I would recommend for those of you who are going to Costa Rica, go ahead and fill it out now. It is up and available. But realizing that many of us are going to be in Costa Rica and not around, week 2 and week 3, just devote those times to identifying articles, accessing articles, and writing. And then, of course, those of you who are doing traveling, especially those of you who are going to be in Costa Rica with me, we're going to be very busy doing stuff down there. Coming up in week number 4, I'm going to have this up hopefully prior to leaving for Costa Rica, a screencast for the role of the committee. And so what you want to be aware of there is checking it out and understanding maybe the flow of work and what the best ways are to have everybody involved in the committee. One person should be your point person. That should be your chair. And the other 2 people serve as experts, content experts. They serve in the role of editing. But the saying goes, too many cooks in the kitchen. You want to be making sure that there is a process for sharing your drafts and communicating with people. And so we'll talk about what that would look like in order to avoid some unnecessary work. As I mentioned before, myself, some individuals from physical therapy, a bunch of you from the PA program, a bunch from the nursing program, as well as a few of the OT students and some kinesiology students are going to head down to Costa Rica, fly down May 15th through May 24th. I doubt that I'll be checking email. One, email can be challenging a little bit, but on top of that, we are really, really busy with some long clinical days. And so feel free to reach out, but know that I may not be able to respond quickly, if at all. So far, ARP 1, you've identified a clinical question, you've collected articles and started to analyze and critique the literature, and you've identified committee members. And I know some of you are still working on that magic number 3. Try to lock that down as soon as possible. You need to have 3 committee members for your final project and paper, and you want to have that diversity of content expertise. For example, if you're doing something that is a drug-related study, it'd be great if you had somebody that was a pharmacist or PhD in pharmacology, something like that. Or if you're doing something with mental health, reaching out to the PsyD department. And if you have questions, let me try to help facilitate things for you, help you out with that. Now, for ARP II, what's the purpose of this class? It is to submit a first draft of your systematic review or your scoping review. We want to have that done by August 15th. In ARP III, you're going to be preparing your manuscript, meaning getting it ready for its final turn in December, having it be as perfect as possible, and also thinking about possible dissemination, so submitting to a journal. And of course, preparing your poster for the research symposium. Now, I mentioned previously possibly disseminating your paper. That should be something that, that you should do. I really recommend it. And here is Rachel Surridge from the cohort previously. Her scoping review looked at the use of virtual reality technology to improve gait and balance in patients with Parkinson's disease. And then, of course, you can see your program director there, and then myself with Kristen Johnson, who's also in physical therapy. Currently have 4 other papers from Rachel's cohort that are currently under review. Actually, it's 3 papers. And I've talked to other people about doing that too. I think sometimes people have this hesitancy like, I don't know if anybody would care about this. But the reality is you're not an N of 1. If it was interesting enough for you to do a lot of work on, it's bound to be interesting to somebody else. So you're putting in the hard work. And again, like I said before, if it's interesting to you, it's bound to be interesting to at least one more person. Now, what is the benefit for you to publish? And like I said, we've got 1 published. We have 3 others or 4 others in review. And ideally, what I would love to do is if you were interested in publishing, help you in that process and do it while the momentum is there. And what I mean by the momentum, in December, you're wrapping things up, things are looking good. Just get it done. Just get it done and see what happens. Now, what are the benefits again? You're contributing to the knowledge base of your profession. That's really valuable. You're identifying yourself as an expert in that area. It may be something on your CV that helps future employment. Maybe it helps with getting into that practice you want to get into because you've done something that shows expertise in an area that's really valuable. Or maybe you want to do some part-time or full-time teaching in the future. Long term, again, you never know what type of clinical or academic setting that you'll find yourself in. And so, who knows? What are the benefits for your committee? You heard the term publish or perish. Now, George Fox is not that type of institution. You might think about like at a University of Oregon or an Oregon State University where faculty members have certain criteria, certain things that they have to disseminate, scholarly work that has to be done. We have scholarship requirements, but they aren't as intense as you might find at a University of Oregon. But there is benefits to your committee members. And part of the advancement and promotion process in a university is the dissemination of scholarship. And so by you submitting, you're helping your PA faculty members, you're helping people that might be in PsyD that are helping you out. So whomever is contributing to the process, it is beneficial for them too. Now, which format to choose? Do you do a systematic review or do you do a scoping review? And that is what this lecture and the materials that are posted online, that's what this week is all about. Now, I think most of you are leaning towards the scoping review. And probably in a lot of cases, from the things I've talked to you about, that's the best idea. Where does a review article fit on the hierarchy of scientific evidence? Well, a systematic review and meta-analyses, that is at the highest level there, the top of the pyramid. Where does a scoping review fit? It's hard to say because scoping reviews don't necessarily have the quantitative component of a meta-analysis. And scoping reviews can sometimes not focus on one thing only. And so what do I mean by that? One of the scoping reviews that was done last year was looking at the use of lavender as a complementary treatment for people with mental health care conditions presenting to primary care. And so lavender supplementation would be something that maybe isn't commonly prescribed by primary care providers, but could be of interest. Well, there wasn't a lot of information if we just looked at one diagnosis, but what we did is we expanded it and focused on the top 3 mental health care diagnoses that present to primary care and explored the evidence related to those 3 diagnoses. So let's talk systematic review first. The systematic reviews involve a detailed and comprehensive plan and search strategy derived a priori, so beforehand, with the goal of reducing bias by identifying, appraising, and synthesizing all relevant studies on a particular topic. A systematic review attempts to gather all available empirical research by using clearly defined systematic methods to obtain answers to a specific question. A meta-analysis is the statistical process of analyzing and combining results from similar studies. So, which one do you choose? Do you choose the systematic review or the scoping review? Now, we'll talk about the differences coming up here a little bit more, but again, that decision is left to you and your committee, and I'm happy if you have difficulty figuring out which one to talk to you about it and explore that. Now, I've written a systematic review that does not contain randomized control trials. But ideally, if you were wanting to do a systematic review, you would be only focusing on a very narrow clinical question and exploring the research that is randomized controlled trials or maybe quasi-experimental only. I think if something starts diving into lower forms of the research hierarchy of evidence, then it should really fall to be more of a scoping review. Scoping reviews are better when there is a lack of randomized controlled trials. Maybe there's 1, maybe there's 2, but there's an overall lack. And so what you're trying to do is gather all available evidence on that topic. Kahn et al., 5 steps to conducting a systematic review. Framing the question for a review. We've done that with the PICO. Identifying relevant work. You've been working on that in ARP I. Assessing the quality of the studies. So now, are things randomized controlled trials? Is it something else? And on top of that, sometimes people like to grade or critique and provide a quantitative number to the quality of a study. Next, summarize the evidence and interpret the findings. This paper is posted this week, plus some other papers. And the whole purpose of the inclusion of these papers are to have reading material that you can continue to explore and understand the differences between systematic reviews and scoping reviews, and to see examples. Now, from Uman, talks about these steps for creating a systematic review and meta-analysis. formulate the review question, define inclusion and exclusion criteria, develop a search strategy and locate studies, select studies, extract data, assess study quality, analyze and interpret results, and then disseminate the findings. Key features of a systematic review. And again, there's examples on Canvas this week, also from your PDF library. So anything that you maybe have kept in your computer. So key features, the description of the search strategy. Look at the methods section of systematic reviews or of scoping reviews. This is what you're going to want to have in your paper. And it allows people then, if they wanted to replicate your study or your search strategy, to do so. Helps people determine how complete something is. Description of the study selection. The results and tables reviewing the studies. And then a discussion and conclusion section. Example now. Energy drinks and their adverse health effects, a systematic review and meta-analysis. So here is the Prisma, and we'll be utilizing this whether you do a systematic review or a scoping review. And here it's illustrating the search process. What's important is to know what the standard approach is for the journal of interest. Now, some journals, maybe they only want to have the Prisma included. Other journals may want to see your search strategy like we did last term. The articles identified by keyword or keyword combinations, which ones you determined as potentially relevant, and then which ones were included in the critical appraisal. Here is an example of a table showing the level of evidence, the study design, and then features of the study, and then a minors score. So this is the quality of included clinical studies appraised via the minors score. The quality was appraised by 2 independent reviewers. Now, the minors score is something that I've not used before, but if a journal that you have an interest in submitting to has requirements, then that would be important to check out and potentially include. Other types of things you may have heard about before, like the Pedro or the Quadus. Here was another table from the energy drink systematic review paper highlighting the adverse events. And then here is the meta-analysis. The meta-analysis is that statistical combination of the results of multiple studies addressing a similar research question. And so what this does is it looks at all of the studies, computes an effect size across all of the studies. Not a requirement for your systematic review. It's something that could be done if you wanted to do a systematic review, and if there was data to do it, we could figure that out. It would definitely elevate your project. Here was a systematic review that I co-authored, and what you can see in the particular table here from the journal Sports Health, they're asking for the study design and the levels of evidence. So that's a way that we're able to describe things based upon the Centers for Evidence-Based Medicine. Again, this was a systematic review. Looking back, it probably would have been better as a scoping review just because of the type of studies that were included. But it also highlights that some journals may not be very stringent on their definition of what a systematic review is or what types of studies are included in a systematic review. So as long as your your question and your search strategy and all of that stuff was defined ahead of time. And how do you know it's defined ahead of time? Is you're going to do a registration online of your project. Sometimes in a systematic review, the conclusions are descriptive in nature. Sometimes there will be the sort statements. Sports Health will do this, where they've got the strength of recommendation taxonomy, and A, B, or C is given to a particular clinical recommendation based upon the availability of evidence. And then, of course, in the systematic review conclusions, you might highlight again some of the information from the meta-analysis. So in the meta-analysis, that's reported in the results section, but it is going to be highlighted again in the conclusion. We'll talk about registering our systematic reviews or our scoping reviews in the coming weeks. Your systematic review can be registered with Prisma. It can be registered with Prospero. It can be registered with the Open Science Framework. Probably if you're doing a systematic review, we'd want to do Prospero. I see that one used more often. Prospero is an international database of prospectively registered systematic reviews. And what's potentially good about it is you can see if somebody else has registered something in the immediate past, because that might influence whether or not you want to do a particular systematic review. Now, for our class purposes, if you found like somebody registered a systematic review in 2024, if it hasn't come out yet, etc., that doesn't prevent you from doing your own systematic review on the topic. It just might be harder to publish it. Might be. And the reason I say that is one of the papers that is under review right now, a similar systematic review was published like a year or two ago, and I had to spend some time writing the editors and saying why our paper is different than their paper, etc. So it's just kind of an interesting little challenge. That's all. Now, if you go the systematic review route, do you have 10 plus randomized control trials? Do you even have 8 plus randomized control trials? Knock that down to 8 there. Let me make a little edit here. Do you have 8 plus randomized control trials? Basically, if you've got a lot of randomized control trials, you might have enough stuff there to really make something meaningful and interesting. But if you don't have that many, then you probably want to go the scoping review route. Here online on campus this week is another systematic review example, Mediterranean diet and health outcomes. Interesting, you're going to find lots of Mediterranean diet systematic reviews. Here was one. This was published in the European Journal of Public Health, and this one was published in Nutrients. So it's not that places don't want to publish a systematic review on something that has been published already. Things need to be updated, right? People might have different bents on things. I saw one time a systematic review that looked at the value of massage for chronic low back pain, and it was given a recommendation that it could be beneficial in the short term, etc. And then 3 years later, another systematic review came out that said it should not be used. It's not going to be beneficial at reducing pain. So it is important to update things. Let's talk scoping review. This Munn et al. Article is online. It's a nice way to review the differences between a systematic review and a scoping review. Indications. Scoping reviews are an ideal tool to determine the scope or coverage of a body of literature on a given topic and give clear indication of the volume of literature and studies available as well as an overview of its focus. Scoping reviews are useful for examining emerging evidence when it is still unclear what other more specific questions can be posed and valuably addressed by a more precise systematic review. So, over there, reasons why you should write a scoping review. Again, to identify the types of available evidence in a given field, to clarify key concepts, to examine how research is conducted on a certain topic, to identify key characteristics or factors related to a concept as a precursor to a systematic review, and to identify and analyze knowledge gaps. Here is a table showing some differences. Now, one thing here, a priori review protocol and registration. I said a priori. I'm sorry. I think I said a priori. A priori review protocol. Basically, scoping reviews should be similar they should be similar to a systematic review. So you are in an a priori fashion devising a protocol for accessing literature. So they're the same that way. Now it says Prospero registration. No, but journals are wanting registration from Open Science Framework. Yes, there should be explicit, transparent, peer-reviewed search strategy in each. Yes, a standardized data extraction form. No, it does not need a mandatory critical appraisal, a risk of bias assessment, but that might be something necessary for a systematic review. And synthesis of findings from individual studies and the generation of summary findings. It says no, but maybe it should be yes too. But what's the difference between a scoping review and a literature review? So traditional literature reviews have been used as a means to summarize various publications or research on a particular topic for many years. In these traditional reviews, authors examine research reports in addition to conceptual or theoretical literature that focuses on the history, importance, and collective thinking around a topic, issue, or concept. It's been kind of a gray thing in the past, in the sense I published a literature review, called it a literature review back in 2008, but maybe it was a scoping review. According to online sources that I found, scoping reviews really got started around the mid-early 2000s. And so here this paper was published in 2008. I probably had it written in 2006. And so scoping reviews maybe just had not been in my awareness, maybe not even in the awareness of the journal that published this particular paper. Forgot this slide was here. Early 2000s, 2005. You'll find this article online in this week's module, Use of Antidepressants Among Patients Diagnosed with Depression, a Scoping Review. So again, another example. And as you go through things, again, look at the methods sections. By looking at other people, that can help inform or guide how you write things. There is a process, there is a similarity between papers. And so utilize that, see how people construct things, and that can help guide how you write your sections. Here's that Prisma again. Here's examples of tables that you're going to find. You got to study what the objective is, the methodological review, major findings. As you look at a variety of different studies, you'll see different tables. How do you want to create your tables? What is the data you want to extract? You're going to be talking about some of the stuff in the results. Now, the results here, very, very limited. We're going to want to write more in our results section. For example, in Rachel's paper, she had some significant text. And so looking at balance outcomes and then exploring aspects and trying to kind of summarize things together. What's great is talking about 7 out of 11 studies utilized the BBS as an outcome measure, and then 3 studies utilized the ABC, and then they talk about what the different components were of those studies. So it gives you an idea, starts to kind of combine or coalesce things together to tell a story. So your results section will definitely be longer than the results section here. There's a discussion section. Again, that puts context to the results, and then your conclusion. All right, that is the end of this week's screencast. There are several paper examples for you to start exploring, not needing to read them for knowing the content, but just explore the flow of things. There are a couple papers in there that do compare or contrast systematic reviews or scoping reviews, because if you're not sure where you need to be, those can help you out with that. Of course, I can talk to you about that too. And then finally, the week 2 forum is up and available for you to post on now.